Good morning, everyone. I'm not able to be here today, but I would like to leave some key messaging because Halloween is tomorrow. So we would like to focus on the importance of public health measures and remind everyone of our messaging from about a week ago. So as Halloween, as you prepare for Saturday, please stay home if you're not feeling well. Limit the number of your contacts. Keep a 2-meter distance from others. Wash your hands often before, during, and after any activity, or use an alcohol-based hand sanitizer. And wear a mask or face covering. The Health Unit is recommending low-risk activities this year to help reduce your risk of COVID-19 and limit potential transmission. Individuals that are at a high risk for COVID-19, such as seniors, people that are older than 70 years of age, and individuals that are immune compromised or have a chronic health condition, should only engage in low-risk activities. So low-risk activities is really staying home, celebrating at your home with your immediate family, and being creative with your activities such as trick-or-treat, scavenger hunt, or hosting a virtual costume party with family and friends. Parties and traditional trick-or-treating increases the number of contacts and potential for exposure to COVID-19, making these very high-risk activities. The Health Unit is recommending that everyone avoid those activities that put them at greater risk of exposure to COVID-19. If you're considering activities other than low-risk activities, we ask that you follow safer recommendations for a safer Halloween. Trick or treat from a distance, wear a proper mask or face covering. Costume masks are not suitable and they do not replace the proper face covering. Practice frequent hand washing. Avoid touching surfaces. Avoid large groups. Limit the number of households you visit if you are going to other households. Not everyone will feel comfortable with participating in Halloween activities this year. And that's okay. Let's give people permission to not participate and not judge them. If you're considering handing out treats, keep these tips in mind. Have a pump hand sanitizer available for kids that may need it. With the parents' permission, you could offer it to reinforce proper hand hygiene and use it yourself frequently. Distribute treats from a distance using tongs or a table that's spaced out with treats. Provide treats that are prepackaged and individually wrapped. Wear a mask or face covering yourself at all times. Place physical distancing markers on your driveway. Consider sitting outside to avoid any large lineups or congestion at your door. Please continue to visit our Health Unit at www.wechu.org for further information, and have a safe Halloween.
Good morning, everyone, and thank you for joining us today. The COVID-19 pandemic is evolving rapidly around the globe, and many countries and regions are now experiencing the second wave, which is worse than the first wave for many. Looking across the globe, we can see how daily confirmed cases of COVID-19 is increasing. This graph is showing the impact of COVID-19 in selected countries. First off, Spain, one of the few countries that was impacted badly in the initial phase of the pandemic, and at the peak of the pandemic experienced roughly 160 to 170 cases per million people. But now they're experiencing roughly around 400 cases per million people. Italy, one of the other countries that was impacted by high rates of COVID death. At the peak of pandemic experienced roughly 90 to 100 cases per million people, and now experiencing roughly 330 to 340 cases per million people. UK at the peak experienced 60 to 70 cases per million, and now experiencing roughly 320 to 330 cases per million people. In US, it's hard to say when they peaked, but in July, they were reporting 200 cases per 200 million people, one of the highest rates in the world, are now approaching 220 to 230 cases per million people. Sweden, and some people use Sweden as an example that they're doing better, but look at their case counts, how they're doing with respect to per million population, and they are much, much higher than Canada, and their numbers are going up very rapidly more recently and are getting more strict measures in place with the increasing number of deaths that are attributed to COVID. Canada, on the other hand, reported roughly 40 to 45 cases per million people at the peak of the first wave, but they're also increasing, and now we are reporting roughly around 65 to 70 cases per million people looking at this data. Focusing on Ontario specifically, this is what the first wave and the second wave is looking like. At the peak of our first wave, we reported roughly around 600 cases in Ontario every day, and now we are reporting more than 900 cases every day. Looking at how these cases are acquired in Ontario, what is concerning to note is that the second wave, and what we are noticing is the percentage of cases that does not have any known epi-link, or in other words, the disease was acquired as a result of community transmission. And when we have a high rate of community transmission, things starts to escalate very quickly, and this is exactly what we are seeing in Ontario at this moment. In Windsor-Essex, this is what the overall picture looks like. We can see that most of our cases were acquired as a result of close contact, and some are acquired as a result of community transmission. If this trends change, or if it starts to follow the same provincial trend, we have to act immediately to contain the virus transmission in our community. I would also mention that what we are seeing in our community is also some cases that are resulting from travel, which is something that we really have to pay attention to, and to remind our residents to please do not go for non-essential travel. So yesterday we reported 6 cases. Out of these 6 cases, 4 were a result of a community transmission, and 1 was related to travel to Michigan. Today, we are reporting 4 new cases, and out of these 4 new cases, 2 are as a result of community transmission, and 2 are part of a close contact. Every day we report these case counts. We report on many statistics, but at the end of the day, some of us are still wondering, how are we doing? What is our current status? In order to make more sense of this data and as a tool for risk communication regarding severity of the COVID-19 pandemic in Windsor-Essex, we are now today launching a local pandemic status indicator for Windsor-Essex. The alert system will be a useful risk communication tool to manage response measures as threat changes over time. These types of systems have been internationally used in non-pandemic sectors, such as communicating risk of natural hazards like floods and forest fires, and they are often color-coded like traffic light or numerically coded, and its practicality have been recognized and adapted for use in pandemic, including COVID-19, and some of the regions are also using the same indicator method to communicate the risk. As the threat of COVID-19 changes over the course of the pandemic in Windsor-Essex, and so do public health measures and government guidance to ensure public safety. Local pandemic status will help our residents to make personal decision, business, and opportunity to modify their operations according to risk levels to keep their businesses safe, and municipalities an opportunity to allow certain events or to provide more or less services to the resident. Mark? So we will be assessing and interpreting the risk of COVID-19 via a combination of epidemiological data. We believe that this clear risk communication tool will help to the general public and prevent an infodemic, which is defined as excessive amount of information that renders it difficult for the public to identify a solution. So we'll try to keep it simple and provide that information. The EPI indicators we are using to assess our local pandemic status is aligned with the Government of Ontario's framework for reopening our province. The thresholds that we are using are all based on the information we have and are subject to change as the pandemic evolves. Please note that these local pandemic status indicators will be updated weekly, but will be monitored regularly to identify any high-risk situation quickly and communicated back to the community. These indicators are grouped this way to ensure that the various risks that are associated with pandemic is mitigated. First off is virus spread and containment, which will give us a better understanding of the local transmission, and will look deeper into the sub-indicators such as local cases, local outbreaks, and the status of all these cases and what kind of risk it will have in the community. For example, a large proportion of cases resulting as a result of community transmission can be much more risky compared to a large group of cases as a result of close contact. Health system capacity is pretty self-explanatory. Public health capacity is also self-explanatory. And incidence tracking capacity will focus on our ability to identify cases in the community through our lab system. The status indicator will range from yellow to red. Yellow will represent a low-risk situation. Orange will represent a medium risk to our community. And red will represent a high risk to our community. We're intentionally not using green in our risk status because we know COVID pandemic still exists, and there is always some level of risk that exists in our community, and we have to be mindful of that risk. Some of these thresholds that you're looking here again today is based on some of the available evidence and are used to communicate the risk based on various combination of how each of these indicators impact disease transmission and pandemic, and that's how they're represented this way, but these are all subject to change depending on how the pandemic evolves. So some of the sub-indicators that we will be looking at virus spread and containment would look at local COVID-19 cases based on a 7-day moving average. Similarly, we will be looking at local COVID cases as a result of community transmission. We will be looking at COVID-19 hospitalization as moving average. We'll be looking at active COVID-19 outbreaks, effective reproduction number, and then from a health system capacity perspective, we will be looking at acute care bed capacity, occupancy, ICU occupancy, ventilator occupancy, and from public health capacity perspective, we will be looking at how quickly it is taking for us to contact all our cases and all our contacts. From an incidence tracking capacity, we'll be looking at the time of test that is reported back to us, and also the percent positivity of these tests that is resulting in our community. So looking into deeper with respect to virus spread and containment, this is the graph that you're all familiar with. It shows the 7-day moving average, and our current 7-day moving average as of October 29th is reported as 6.0. And it's a slight increase from what we reported last time when it was 4.3. And anytime when the moving average is under 5, it means the risk of transmission in our community is low to medium. But now what we are seeing, it's slightly past that 5 mark, and that's why we're reporting it as a concerning trend to see that the 7-day moving average in the 6 range, pointing out that maybe there are more viral activity that is happening that we like to see, and as a result, it is coded as orange. This is also this is a new graph that you are seeing. We presented it last week, and it is a measure of the percentage of cases as a result of community transmission. If the community transmission is high, that means we have cases in the community that are either not following the public health guidelines and spreading it to others, or those cases that are not one is aware. As of today, our community case transmission rate is at 30%, which is our threshold as well. So it's just barely passing that threshold to jump in from a low risk into a medium risk situation, and that's why it's coded as orange. This graph is looking at the COVID-19 hospitalization from a 14-day moving average, and one of the ways to interpret the graph is to know the severity of our COVID-19 cases. If more and more cases are hospitalized due to COVID, it may point out to either a change in the severity of the disease itself, or maybe the fact that we are only catching the very sick people in our community. If we see any concerning trend in this sector, this will be a concern for us. So right now, based on what we are seeing, the numbers are low and are rated as low risk, and that's why it's coded as yellow. This graph is looking at the number of active outbreaks, while a contained outbreak, if it is, may not necessarily be a threat to the community, but can require more community resources to manage. And on the other hand, any uncontrolled outbreak can potentially spill over to the community and can pose a greater risk of the community, especially with a large place outbreak. And based on what we are seeing right now, the number of outbreaks that are currently active for COVID is only 1, and that's why we're reporting it as low risk at this time, and it's represented in yellow. You're all familiar with that. This is the effective reproduction number, and when you have a effective R naught, which is less than 1, that means the new cases of infection is less than what it was in the community. So that means there are no new cases that are coming in, or the number of cases that are coming in new is less than the one that we have seen in the past. So what we have noticed, especially in the last week, we have gone down to quite a low number of R naught, but we're seeing some trend with some infection that are spreading, especially in the close contact, and that's why we are seeing an effective R naught, which is in 1.34. Much higher than what we reported last time, and that's why it's looking at the trend perspective, the R naught is pointing out that there are more cases that are coming up, and that's why it's coded as high risk and is categorized in as red color. From health system capacity perspective, the slides depicts our acute care bed capacity when we are well below, when we live within the 90% threshold. That means it's fine. And in recent days, we have seen that the threshold is crossed, signaling that we may be pressed for resources if more cases of COVID-19 comes up. Please note that this acute care bed capacity is not only for COVID. This is for entirety of the acute care beds in our region. Also includes many of the non-COVID, post-surgical or elective surgical candidates and everyone involved. So right now we are reporting an 83% acute care bed capacity, which is slightly higher than what we like to see, which was our threshold is 80%. So anything above 80% is coded as medium risk, and that's why it's coded as orange in our slides. Looking at the intensive care bed capacity, similar picture. The threshold is 90%, so we are below the threshold that we have set up. And as of October 27th, it was noted at 79%, which means that there is a low risk associated with ICU bed capacity perspective, and it's coded as yellow in our system. Looking at the ventilator bed capacity, also, while there's no threshold established, 60% is something that we look for. So we are close to 31% now, which is obviously indicating a low risk, and it's coded as yellow. Looking at our public health system capacity to connect with cases and contacts from the date reported, and between October 19 and October 26, 98% of our cases were contacted within 24 hours, and 96% of the cases, contacts were contacted within 1 day of being reported to public health. So we are doing well in that public health capacity to connect with all these cases, and is considered as a low risk, and that's why it's coded as yellow in our system. Looking at our incidence tracking capacity, this looks at the percentage of test results, and that includes all test results that are available within 1 day and 2 days of someone getting the test results using a 7-day average. Recently, from September 10th onward, we have seen a sharp decline in the 1-day turnaround time, but all these indicators are now getting better. More recently, what we are seeing is the number of cases that are completed within the next day is currently standing at close to 39%, and that's why it's not the ideal, and it's coded as red, whereas the number of cases that are reported back to us within 48 hours or 2 days, it's close to 82%, which is in the yellow range, which is what we like to see, and that's why it's coded as a low risk. But the number of cases that we like to see in 1 day, it's much lower, and we like to see that improved. Looking at overall person positivity of all the tests that are conducted in in Windsor-Essex, and in total, we have seen more than 124,486 million tests that were conducted, and out of these, what we are looking at a person positivity of 0.7%, and our cumulative person positivity since the beginning of this pandemic is 2.5%. And in the last 4 to 5 weeks, our person positivity is roughly around 1%, which is still a good sign given what we are looking at in our region. Last week, there were approximately 651 tests that were completed daily for a total of 4,558 tests that were conducted in our region. Not where we would like to see, but as we know, there are a number of changes that happened as a result of the testing policy changes, and we're now focused more on the cases to make sure that the needs of the community are met. So based on all of that, our current local pandemic status for this week is orange, which is, we can see that as a medium risk, and this is based on the subdomain of virus spread and containment, which is in orange. We have a public health system capacity, which is in yellow. That means the risk is low from that perspective. We have our health system capacity, which is also coded as yellow or low risk. We still have concerns about the incidence tracking system, our lab capacity, then that's why we have classified it as a medium risk, and it's coded as orange. And overall, as a community, what action is associated with that is we need to focus attention in certain indicators to address growing concerns of COVID-19 in our community to keep our community safe. Based on that, some of the recommendations for our individuals, which is always would be the same, irrespective of which color you are in. Stay home if you're sick or have symptoms, even if it's mild symptoms. Wash your hand regularly with soap and water. We've been talking about it for 15 to 20 seconds. Or use alcohol-based hand sanitizer. Always cough and sneeze into your sleeve or a tissue, and please discard your tissues immediately without touching anything else. Keep surfaces clean and disinfected. Always maintain 2 meters physical distancing at all times. Doesn't matter where you go, you must always maintain 2 meter physical distancing, even when you're wearing a mask. And this is not, wearing a mask doesn't allow you to break that 2 meters physical distancing barrier. You should still maintain your physical distancing of 2 meter at all time, and only in some certain circumstances, such as when you're crossing someone, if that 2 meter distance is not maintained, that can be okay, but you always do your best to maintain your 2 meter physical distance. And you must always wear a cloth mask if you feel that there's a physical distancing cannot be maintained, and always follow provincial guidelines. For individuals, when they're considering a socialization in the medium risk situation, such as in orange, you should try and limit your close contact to household members, maintain physical distancing and wear a mask when in contact with everyone else, avoid indoor gatherings with people who do not live with you, and connect with your friends and family virtually. When you're thinking about staying physically active, avoid group fitness classes where physical distancing cannot be maintained or masks cannot be maintained. Avoid close contact sports with members that are outside of your household. Consider outdoor exercises where physical distancing cannot be maintained, for example, walking, biking, and hiking. And consider indoor exercises at home with members of your household, for example, yoga, dancing, Pilates, and other activities. Consider virtual fitness sessions with friends and families. And always consider active transportation, such as walking or biking to essential services. So in summary, we are using COVID monitoring indicators to assess our local pandemic status, which will help our community to make informed decisions to reduce COVID-19 transmission risk. The current pandemic status for Windsor-Essex is orange, which is a medium risk. And what we are noticing is mild increase in viral transmission, and we need community action to decrease transmission. And we need to do our part. The businesses, they need to do their part to keep their businesses safe, and keep an eye on any indicator, any trend that could change that number. And it's a responsibility on all of us, including all our businesses, to keep everyone safe. It is of no help to anyone if the case counts increase in our community, which could lead to further restrictions in the region. What we are also noticing is decreased incidence tracking capacity, and obviously the laboratory system to provide timely tests is something that is already being worked on. We need to focus attention on the areas that are identified in this epi summary to address the growing concerns of COVID-19 in our community. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Today we'll start with CBC.
Hi, Dr. Ahmed.
Hello.
I'm just looking at some businesses locally that have set up dome structures outside just to continue with outdoor dining as the weather gets colder. I know that the health unit was kind of saying that these maybe don't comply with the outdoor dining rules, that there's fire safety codes and other local bylaws to consider. Will you guys reconsider your policies so that businesses can use something like this to kind of keep up throughout the winter months?
It's a good question. I think obviously we are always here to work with our business community to provide them with the safest way to ensure their safety as well as anyone's safety who are coming into their businesses. So anyone who's thinking about that, please connect with our team, and we can connect with them. We can provide them with the best advice, what they can do to ensure the safety and well-being of everyone. And so that offer stands. What you are alluding to is a situation where unfortunately the business didn't connect with us, and we're using some practices which were not based on the best practices and our recommendations. And we hope that anyone who's thinking about any of those things connect with our environmental health team to get the appropriate guidance, because every situation is different. We'll have to look into each of those situations and provide a recommendation based on all the risk that we are trying to mitigate right now.
What would be some concerns with structures like this and people dining in them?
Well, what you're looking for is the clear no ventilation that's happening. And in that type of situation, people, if they're sitting together and if any of them are sick, they can easily infect anyone else. And that's why some of those guidelines, it has to have clear ventilation system available for those individuals, so to allow air to flow, especially when you are sitting with people who are not part of your household and can put others at risk. So I think those considerations are there. Some of those information are on our toolkit, that if you are considering any of those canopies and any of those type of dome, what are some of the best practices that are recommended in that setting. But as I said earlier, some of these considerations need to be connected directly with our team to get the specific guidance.
Thank you so much.
Any questions from AM800?
Doctor, on that, for the statuses, wouldn't it be easier instead of going colored way? Wouldn't it just be easier to tell the community if we're low risk, medium risk, or high risk?
Well, we thought about that and that's why we will be reporting exactly as the same as when we are putting in colors. We will be putting in some of the wording as well, that it's low or medium or high. And again, everyone's have different preferences. And what we've noticed is, most of these regions and for general public, I think for some of the situation, they like the color coding system. You may have a preference, or I may have a preference to just maybe see what this risk status mean. But we'll make sure that we'll try to cover both and to provide that guidance that if it's a low, medium, or high risk.
Will this be updated daily, weekly, during your daily your conferences every other day? When will it be updated?
So right now, based on some of the other data that we receive, it would be very difficult to update it daily. We may not catch up to provide you with the most up-to-date information. So the ideal situation, right now what we're looking at, this will be updated every week, but we will be monitoring each of these trends as we always do. And then if there's any concerning trend that we are identifying, we will be updating the community as such. But right now, the goal is to keep this data posted every week. And right now, what you will find is some of these detailed summary will be available, just like we have shared some of our epi summary in the past. So those details will be available in an epi summary. But moving forward in the next few weeks, what we will try to do is we'll try to convert the same data in a form of a dashboard that you are looking right now at on our website, with various indicators that you can play around with. And then one thing which I don't know if public and the media is aware or not, but if you go to our dashboard right now, where we are showing the cases, the cumulative cases as well as active cases, there's a link there right under that graph that will take you to a much more high resolution image of the cases in our community. And if you haven't tried that, please try it. It will provide you with more detailed graphics of what and where those cases are, and some of those things that we continue to improve on our website.
And then finally, has this been in the works for quite some time? How did this all come together? You and your team, or I guess was it the public asking for more information? What risk our community is at? How did this all come together?
Well, Rob, as you know, throughout this pandemic, our staff, even though we are one of the lowest funded health unit in the province, and we have a small team of epidemiologists and the number of staff that are much lower than comparable health units of the similar size, but all of this takes time. And some downtime as well to focus on the issues that we are not chasing after one another. This was been in the work for I would say at least 3 to 4 weeks that we were trying. We have had some support from some of our students as well that are working with me from Schulich School, and also our epidemiologist who is working probably a lot to make sure and find new ways to continue to provide information to the community. And we recognize that the community needs information. Obviously, in the beginning phase of the pandemic, we are all focused on what is coming next. There's a lot of unknown that we were dealing with. Right now, we have lots of data that we can share to help create a better understanding, because the only way what we can get community to know what is expected of them is to do a clear risk communication. And I think this is what we are trying to do, is to communicate the risk in a way that everyone can understand. It shouldn't be that complicated to understand what is at stake and what is driving some of these numbers and what are some of the measures that is needed. So hoping that with all this work that was that went behind the scene, which took us a number of weeks to get here, the community will find it useful. We will always look to improve and add further information to provide more clarity, and that's the goal. That even you will notice in the next few weeks, you may notice additional data elements and additional consideration that we will share with the community.
Well, like always, thank you very much.
Thank you.
Any questions from the Windsor Star?
Thank you, no.
Any questions from Blackburn?
Yes, good morning. You put some recommendations there for when we're in the orange level. If we were to reach the next level, is that when you would be recommending or looking to the province to put in additional measures or potentially like move us back into that modified stage 2 phase?
Well, I think that's what we hope that, when we are sharing these type of alert levels and alert system, and then also thinking about, what is driving those numbers and where are some of those action areas that we need to consider. And we want everyone to be prepared, because even as I said, as I always say, think about what is at stake. So as an individual right now, let's say if our community is in low risk, there may be some activities that I can do. Maybe I can hang out with my friends. But if I'm in the medium risk category, should I be hanging out with my friends or not? That's the question that we need to ask. And let's say we move further and we are talking about, okay, now we are in the red category. Should I even go out, or why do I need to go out if it's a non-essential visit? So those are the considerations that we need to think about from as an individual level basis. So as a business, if I'm in the same situation and I'm thinking, okay, the risk right now in the community is low, so yeah, maybe I can take, if I'm not paying that much attention in terms of, how my employees are doing or how everyone is behaving and how strictly I have to enforce the rule, maybe you can get away with that. But if you are in an orange status or a medium risk status, where you know that there are community transmission that are happening and at a rate that can easily change everything, I think that's the time, especially for the businesses, to be really, really diligent in how you are conducting your business. Because any changes, anything that happens, it can not only put you, your staff, your business at risk, but it also increases the risk in the community. And those type of setting, those business settings where these type of transmission are more likely to happen, and if that is happening in those businesses, it is detrimental not only for them, but to the entire sector and to the entire community. So I think those are some of the messages that we want to communicate, and also even for the municipalities, and thinking about, most of these in instances when we are talking about restrictions or a modified rollback of some of these opening. What does it mean? And what does it mean for the municipalities? That are they prepared? Are they prepared to even think about their own services, that how they will update their service, expand their services, or cut down their services, or on thinking beyond from an enforcement perspective, what do they need to enforce on? And if they are also managing some of these bylaws to allow certain businesses to open or certain businesses to close, what does that look like? And when do they need to take action? It would be ideal that we are all working together to do what is right for our community, rather than someday someone in the province make the decision for us. So I think we have to work together to have a better understanding of the risk to our community, and then take action when it's needed. And you're right, if it gets to a red time, I think that's where we'll have to act immediately to contain the threat. But hoping that even the orange status will keep everyone on their toes, and making sure that we are thinking in a time when we are not in a crisis before we go into a crisis, and have everything in place.
And you kind of weighted each different indicator, and you gave it a level. Is this just an average? Are some indicators given more weight than others? How is that kind of overall risk determined?
So that's a good question. So right now, these four major domains that we have identified, they are weighted equally. But when we are talking about the overall risk status that we are assigning, there is some consideration to and weightage given to that. And there's again, those are all easy things to show, but there is obviously a good calculation and assessment that's happening in the background. From where I see is our biggest threat is the virus spread and containment, and some of that is it's feed on to other. So if you have a high virus spread and transmission happening in the community, it would lead to a stress in the public health system. It will lead a stress to the healthcare system, because as we know, at least 10% of these individuals who contract COVID, they need hospitalization. And then that would overburden the hospital system. And in turn, the hospital system, when they are overburdened, they have to think about shutting down some of their non-essential services. And then when more and more people need to get tested, they will go into the lab system, which will further delay it. So a lot of that is a very complex and intricate relationship with each of these indicators. But the key is obviously where everything starts is the virus spread and containment piece. So in an overall assessment indicator, virus spread and containment is given more weightage compared to the other indicators.
Thank you.
Any further questions from CBC?
I'm all good, thank you.
AM 800?
Dr. Ahmed, sorry, I'm just focusing on the statuses. I might have missed this, but how many active cases do we have in Windsor-Essex right now?
I don't have that number in front of me, and Mike can maybe send it to you right after this call.
Okay, thank you, appreciate it. Have a good weekend.
Thank you.
Any further questions from the Windsor Star?
No, thank you.
Blackburn?
No, thanks.
Thank you, everyone. Have a good weekend.
Have a good weekend. Happy Halloween.
Thank you.